So let's go over your treatment plan. Okay. It's typically a 3 treatment series where you would get 1 treatment every 4 to 6 weeks because that coincides with your hair growth cycle.
4 to 6 weeks.
Yes. So say that you're getting your first treatment today, and then you wait 4 to 6 weeks, and then get your second treatment, and then another 4 to 6 weeks.
Okay.
Getting your
so over a 3 to 4 month period, I should have all.
Yeah, around 2 to 3 months.
2 to 3 months, I should be done with the treatment.
Yes.
Okay.
And on average, it takes 6 to 9 months for you to notice a difference.
From starting from today or from the end of the?
From the end of the treatment.
Okay, so call it 3 months plus 9 months.
Yeah, 6 to 9 months, yes. So usually after the treatments are completed, we would tell the patients to set up a follow-up appointment 9 months after.
Okay. Sounds good to me.
Okay. Any other questions?
Yeah, so you were talking about products that go along with it. So maintenance, there's a supplement you were talking about?
Yes. So we will be including a hair loss shampoo, hair loss conditioner, that are made for hair loss. And then a DHT blocker, which is the herbal supplement.
Okay.
It contains saw palmetto seed oil and pumpkin seed oil that are natural DHT blockers.
Okay. What would you say, I was also considering doing like transplant.
Okay.
Right? And, the difference between, like, when should somebody really be a candidate more for transplant versus this?
Well, I can't speak for hair transplant because I'm not a hair transplant expert, but I can tell you that I would say hair transplant is probably the old standard, because it is a full-on surgery. Right. It takes 8 to 10 hours to perform, and you are awake. Okay, and a limitation about.
You're good. Just keep rolling, we're good.
A limitation about hair transplant, or the biggest limitation is that people don't know. People think that they can just transfer hair from here to here and that's it. I'll cover it. Each time you can only transfer so many grafts because you don't want to run into a problem called over harvesting, right? Because you might end up losing more hair. Okay, and also with hair transplant, if your hair loss is genetic, yes, the area that they transfer the hair to might be long lasting, but the rest of your hair will keep shedding. Okay, and also there's the price factor.
Right, it's a lot more expensive. I got a quote here in Frisco. It was like 15,000. Yeah. Everybody goes to Turkey because it's so expensive. They just go to Turkey.
Yeah, but I always say that it's a medical procedure or medical surgery, right? If something goes wrong, you might end up spending more.
There's horror stories of people that get botched up pretty good. So
we actually see quite a few patients after failed hair transplants.
Right.
Yes. Sometimes people would get multiple hair transplants and still would see no results.
That would not be good.
Not saying that hair transplants, wouldn't be a good solution for some people, right? I would say hair transplants.
I might still do it at some point. I don't know. I might still. I want to try this first. For me, I feel like this is.
You want natural.
More natural, non-invasive.
Yes. Right. Zero downtime versus hair transplant.
Yeah, like I got a date tonight. Okay, so I'm gonna come in here, get hooked up, and then I'm gonna go on a date.
Yeah. So.
I couldn't do that with a transplant. I'd be looking crazy.
Yes. So stem cells also has anti-inflammatory property.
Okay.
So a few minutes after injections, you wouldn't even be able to tell that you just had injections.
Oh, okay.
So there's zero downtime. You can go about your day right after.
Who's not a candidate? Like, who wouldn't be a candidate for this?
For stem cell therapy?
Yeah.
Good question. I would say someone who has active cancer or an active tumor.
Why would you? What's the reasoning for that?
Well, I mean, anytime you have cancer, you should not go through any type of procedure.
Okay.
Yeah, there's not enough studies on procedures on cancer patients, so it's it would be a risk for us to take, and we always try to be safe.
Got it.
Especially if this is a kind of a non-essential procedure.
Are there any potential side effects?
No. Again, going back to stem cells being natural and
Right.
anti-inflammatory, there's no side effect.
Okay, that's cool.
Yeah, I would say the only possible side effect would be skin infection, but that's if the provider does not prep your skin well, or go through a sterile preparation.
Got it.
Yep, but it's knock on wood, it's never happened here.